Buddha Tzu Chi Foundation is a faith-based organization. Tzu means compassion. Ji means relief. To relieve with compassion. Buddhist and Catholic dialogues really go back to 52 years ago. Tzu Chi established because 3 Catholic nuns visit our foundation and they ask, why Catholics doing so many social movement and we don't see Buddhists except meditation chanting in the temple? They don't go into the community. So this is the seeds of the inspiring. So from there, past 3-4 years in Los Angeles, Buddhists and Catholics started wondering, there's so many social issues. We are doing the community need assessment. We are trying to figure out what would be the best way to revive the economy. So that's why 3 years ago, 2015, there's 5 sites. The 5 sites from New York, Washington, D.C., Chicago, Los Angeles, and San Francisco. All the faith-based leaders, everybody sit down and then review what's the situation. That's why come out the 5 sites, and everybody agree. The CHA, the community need assessment, the most important right now is how to solve the homeless issue. And the homeless really play a very serious situation around our street. Monthly, we meet together and to see what will be the major issues currently this month for the homeless and how can we solve the problem. And we all know the major issue is housing. So when we look into the housing situation, we are very grateful. We have our supervisors, Thomas Riley. He is right in the Martin Luther King Hospital. This is Hospital Revive. And they have a project called Recuperative Care Center. And this is the homeless, after they have drug, they have a lot of overdose and a lot of issue. So they go to the hospital do the screening, and they willing to stand up by themselves again. So the hospital referred them to Recuperative Care Center for 3 months, 6 months. Buddhists and Catholics started new pilot program this year, working with RCC. Every month, Tuesday night from 6 to 7. We have 1 week is Buddhist, the other week is Catholic. So the leaders, the community partners rotate. Within 60 minutes, we bring the peace to the residents inside the RCC. I remember very clearly one story, a gentleman called Jack. He entered to RCC only 3 weeks. For this program is each individual in the daytime, they need to go outside to find how can they apply for a job or to know the community well because they've been isolated. They've been inside their tent on the street. So to them it's shy to reach out to the community. So we RCC encourage them to go outside to find how can they go into the society. So when we have that program, I remember very clearly that day we do walking meditation. It's a Buddha session. So we do 10 minutes walking meditation. Jack joined with us 6:15. When he come in, he's so quiet. He don't say anything. He just follow. And then 6:30, after 10 minutes meditation, we sit down and with the music in the background. So slowly we ask everybody to share what is their day. Jack is the last one to share. And he just opened his mouth and share his thoughts. He said, I've been so depressed today. I walk on the street. I cannot find myself to be part of the group. And I don't know what should I do. I don't have my family. I don't have anything. So I really lost. And when I come into the residence here, the nurses tell me, there's a Buddhist meditation session. Would you like to join? And I walk in. I just wondering, what am I going to get out from here? So you teach us how to walk. The walk is a mindfulness. Tell me how to be concentrated to walk. So I feel like even 10 minutes, but I can do something by myself. I feel I'm very proud. I can get along with other people. We can walk together. This is the partnership for Buddhists and Catholics to bring the community, to empower this individual to be able to going back to the society without worry. People will think about why he's doing this way. Oh, he's not the one we need to engage. So this is a successful story, and that's the one we see. Jack coming back now, become a volunteer at RCC, so he become a mentor to tell people. And then also we see the staff from the RCC participate in meditation, or Catholic, they do the Bible study. Just one sentence you can inspire, you can find them to find their hope. And this kind of giving of hope for the homeless is a teamwork. The teamwork coming from leadership from the government representative, the hospital representative, and local public health. They can identify they have needs, refer to the RCC, and faith-based organization to support the spiritual care. So this is a teamwork, a circle of love.